Hi, Dr. Riley. Oh, and I see we have a few people on already. Hi, I'm Dr. Allison. We're going to get started in just a second. Let's see. Hi, can I hear you?
Hello. Yeah, can you hear me?
Yep, yep, perfect.
Oh, fabulous. Okay,
Yeah.
cool. Great.
We'll get started in just a second. I'm just trying to see if I need to push any recording. Okay, no, it's already happening. Great. We're not going to do a PowerPoint this time. I'm just going to
Okay,
chat.
perfect.
We'll
Hold
go
on.
free.
Great.
If you're already joining us, I would love to know how far postpartum you are. If you're under a month, under 18 months, 2 years, whatever it is, I would love to know. So if you want to answer, you could do that in the QA. I think that's where, or there's also a chat. Cool. From my last kid, I am, oh my, almost like 3 years postpartum, 2 years postpartum. Awesome. Welcome. We're just going to give it like another minute. I'm Dr. Allison. This is Dr. Riley here. Oh, you're 7 weeks
You
postpartum.
guys.
Awesome. Congratulations.
Oh,
Oh, the chat's disabled. Let's see.
oh,
Answer. Oh, that's interesting. Hmm. Okay.
weird. Wonder why
Okay. Let's see. How can I enable it? So
that's
it's
a great question.
probably to block names for confidentiality. Okay. So yeah, QA would be the way to go. Perfect. Okay. We'll get started in just a few minutes. As we go through and talk about all things postpartum, if you have questions, please drop them in the QA. This is a lot of fun. If it's open, for confidentiality purposes, because we are recording it, we have blocked your names. Great. It is so fun to see everyone joining us. It is such a beautiful day.
That's gorgeous out.
I feel like I can see you across the water, Riley.
I know, right? Just waving across the water.
If you haven't been to our Edmonds office, we look out over towards Kingston and towards Poulsbo, so we pretend like we can see each other.
Yes. Yeah.
So.
Exactly.
All right, I think I'll just get started. We're 2 minutes in, so might as well. Yeah. People will just keep joining us, and we are recording this. So if you want a record, we're definitely happy to send out a replay of this. All right, well, thank you so much for joining. At the end, we're gonna have a couple people who have come to Body Motion for postpartum care to hop on and share a little bit about what postpartum healing looks like in their eyes. And yeah, so I'm super excited about this class. We're going to talk about everything that you need to know postpartum and what should be happening in your body, what's normal, what's not, and everything that you want to start doing when we talk about recovery. So 7 weeks postpartum was our first person I saw. Let's see if there's anyone else wants to drop in how postpartum you are. I would love to hear it. So just drop it into that QA, that little QA box, and we can, and I would just like to know, I can tailor it a little bit more. 7 weeks postpartum is awesome. It's so great that you're starting to collect this information now. We have another that says 24 months postpartum. So that is fantastic. And yeah, so once postpartum, always postpartum. It's a saying that we say often around here, and our bodies change forever in 5 years postpartum. Fantastic. Awesome. Yeah, so our bodies are changing constantly, and the pelvis is changing. Our hormonal picture changes after we have babies, and a lot of times our hormones don't stabilize until about 18 months after you stop breastfeeding. So if you breastfeed for about 2 years, that can be another 18 months. A lot of people spend 5 to 10 years in this hormonal flux period having multiple babies, and that takes a toll on our bodies, but totally we can be strong through all of it. It's just knowing exactly what we should be doing with our bodies that we're going to dive into. If you signed up for this, I believe that we said we would send you a book. So Isabel from our office will be in touch with you to send you a copy of Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age. So that's this book here. And that's really the basis of body motion physical therapy postpartum protocols for healing. I go through it in the book. We're going to touch on it today. What we do here at Body Motion is a little different. So if you've been to pelvic floor physical therapy before, or you've been to another pelvic floor PT after you had babies, I might say some things that are different than from what you learned, and that's okay too. I'm talking very generally today, and I can't tailor everything specifically to your body, but we would be happy to tailor it to your body in a consultation format. So if you want to come in for a discovery visit, we do offer complimentary discovery visits, which is a 30-minute consult with Dr. Riley, myself, or our other providers here. And we talk through your whole history, get to know you, get to know your body and what it's gone through. We talk about your birth history for whatever you're comfortable sharing. So we have an idea of what your entire body has gone through, and probably where you're at right now. And of course, where you want to be. So I think that's really important when we're talking about this type of healing. Healing our pelvic floor throughout our life, whether we have babies or not, is a continual process because we're continually changing. When we have a baby, that is massive impact. So our pelvis, I'm going to grab my pelvis here. And I'm going to be watching this chat, which I'm not doing a good job at. Okay, cool. Okay, our pelvis here spreads about 5 to 7 millimeters when we are pregnant. And then through delivery can go all the way up to 9 millimeters. That's a huge spread here. Our joints become loose and typically more unstable in order for the joints to be able to spread to get a baby through the birth canal. That spreading starts all the way at 6 weeks. So from actually implantation. So once we get implantation, the joints start to change and relax and can peak. So that hormone that causes the joint flexibility can peak around 6 weeks. When we have our joints getting loose like that, typically our muscles become really tight to try to hold us together. That is true for the muscles of the butt. That's true for the muscles of the pelvic floor. It's true for the muscles of the abs. And then the muscles have to stretch, especially the muscles of the abs, because we have to stretch to accommodate for the baby. So certain things can happen postpartum that start during pregnancy, and that's where we can get a separation. So where the linea alba, which is, if you think about the midline of the belly, you can get something called a diastasis recti, and that's where you start to get spreading of the 2 six-pack ab muscles, which is called your rectus abdominis, and that can create what's called a diastasis recti. And so a lot of times postpartum, it's really common to have at least some separation of those 2 six-pack ab muscles. And so we want to facilitate those coming back together and generating really strong tension in there and just having a really functional core. A lot of times what we see is postpartum, people will have either pushed a baby out of their vagina, or they've had a belly birth. And regardless of how a baby comes out of your body, it is a massive, massive event. So if your vagina has to spread really far in order to have a baby, there can be tearing. There can be micro tears. So even if you didn't tear, when muscles overstretch, they still have to heal back together, and that can create scar tissue, depending on how healthy that tissue was and how used to stretching that tissue was. And then in the belly, if there's any scar tissue at all, that can also limit the ability for you to contract your deepest of core muscles. And so we want to work through that, and we want to start retraining all of those muscles. Questions so far? Riley, anything I've missed so far? Talking really fast? Maybe slow down?
No, everything sounds great.
Okay, cool. Jump in if you feel.
Mhm.
Okay. So, all right. So we're going to just continue on. So when we talk about like the essentials for postpartum healing, I'm super biased. I'm a pelvic floor PT. This is what I do. I've become this because I used to work with women in their 50s and 60s, and I saw them getting hip replacements, knee replacements, all the while they were still peeing their pants. And the reason they needed these replacements is because they never regained their core after pregnancy. And so that's where like all of my passion has stemmed from. And that's why I firmly believe that postpartum recovery is just absolutely essential. And we can go to the gym, we can start to get our bodies back or our strength back, whatever you want to call it. I don't really like the body back thing. But I really like, getting our strength back and getting our stability back so we can feel really strong and good in our new bodies. And when we think about it like that, then it makes sense that we're protecting our body and our joints for the rest of our lives. And all of a sudden, a lot of times when you become a parent after you go through childbirth, your ideas change of what you want for your body. And a lot of times that's long-term health. And so that's what I'm here to preach. And that's why I am so biased that I truly believe working with a pelvic expert physical therapist is super essential to help you heal your belly and heal your pelvic floor. So a lot of the things I'm going to talk about, we're going to start that journey together. But I think that it's important to know that also working with someone individually is going to help you tremendously in your own, like, to be tailored exactly to you. Because what I'm going to say today is pretty general, but it'll give you a great basis and tools to start working with. So when we talk postpartum recovery, we want to talk, number one, about starting to help heal any scar tissue that's developed. So if there was scar tissue in the abdominal wall, if there was scar tissue within the pelvic floor muscles, which is down here through the vagina, we want to start to heal that. We want to heal that so the muscles can relax and contract easily without restriction. If there's scar tissue here, it makes it really hard for a muscle to contract and really hard for a muscle to relax. So we want to start working through that tissue. So that's number one. So once we start working through that tissue, then we can start retraining the tissue to go into the directions that we want it to. We can do that through activating muscles. We can do that through relaxing muscles. And once we start to do that, then we can start to balance the rest of the compensations that have developed. So if you were like me and you had a knee surgery growing up, or like Dr. Riley and you had a knee surgery growing up, then you become pregnant, a lot of times those issues are exacerbated during pregnancy. If you had low back pain, early in your 20s, any issue that you've ever had was probably exacerbated during your pregnancy. And so then we develop compensations around, maybe it was like that painful knee. And so we walk heavier on our other leg, and those create imbalances within the pelvis itself. So it's really important that postpartum, we help heal these imbalances so you don't end up with low back pain and hip pain, as the years progress. So we want to balance the muscles in the butt on both sides. We want them to be even, so you're not really strong on your right side or really strong on your left side. One of the ways that you can kind of tune in and you're like, what is she talking about? Balance your pelvis. Well, if you're holding your kid on one side of your body, especially like 7-week-old, like if you're mainly holding on one side of your body, are you finding that you're shifting mainly to your right leg, or are you shifting to your left leg? And you can kind of tune into that and just think, okay, I'm just going to stand evenly on both feet. Can I do that? And that will just start help driving the forces up through your skeleton symmetrically. And that's really important with what we get through when we talk through core activation and absorbing forces through our joints. And we're going to talk through that in just a little bit. So that's the first piece we want to help, or the third piece is we want to help with those compensations. I'm just reading the Q&A. Oh, okay, great. Then we want to talk about rebuilding and kind of getting you back to whatever fitness you want to be doing, whether that was pole dancing or CrossFit or running or walking, whatever it is for you, we want you to be able to get back to that mobility. So we will start building on to that. But the basis of everything that we're talking about today is how to get to that point. How can we get to the point where we can safely get back to the gym, safely get to CrossFit, safely get to pole dancing, if that's your jam. I guess that's just coming to me because I just was with someone that was pole dancing. So I love that. And it's very popular, especially where you are, Riley, right? There's new pole dancing classes.
Yeah. I have patients that do it.
Yeah. So it's amazing. But let's tune down now, and we're going to talk about all the aspects of the core and how to start healing them. So here is my pseudo core. Okay. It's a soda pop can. The front side is the abdominal wall. The back side is the butt and your back muscles. So front side abdominals, back and butt muscles, and then the bottom of the core is the pelvic floor. The top of the core is the diaphragm. Our whole goal postpartum is to develop a strong, coordinated core that has this amazing pressure like a soda pop can. And if we had, you can also envision this core as a slinky or some kind of piston. So every time, or a spring is a better idea. If every time your foot hits the ground, there's this core that helps absorb the shock, so the shock doesn't go through your joints, and continual shock creates arthritis and wears out those joints. So we want the core, those shocks, to be absorbed by this dynamic, mobile core that has a really good pressure system. What happens postpartum is that our diaphragm has lost its normal strength and position. It's mainly lost its strength because of its position. So it'd be like popping the top. All of a sudden, we don't have this great core pressure that gives us our natural strength. And then we also have issues in the bottom of the core. I'm going to drink this because it's falling all over. And so we want to help restore that. So in order to start restoring that, we are going to talk about retraining the diaphragm. This is going to be one of the 3 things that we're going to talk through. Retraining the diaphragm. So how to get your diaphragm moving in the ways that we want to help restore that top of the core. And then we want to retrain the bottom, which is the pelvic floor, so it can relax, overstretch, and contract. The same things that you needed to be able to do for childbirth was relax and bear down to get the baby out. And now we still need that motion postpartum. And those motions postpartum, you might think, oh, a lot of people come to us and they're like, I have no strength in my pelvic floor. I'm just blown out. A lot of people will say that. And you're like, no, you're actually not. Like, the reason you have no strength and no sensation there is because everything is so tight and bound down with this scar tissue that you don't feel like you can contract because everything's already fully contracted. So we work a lot on helping opening up those muscles. We're going to go through some breath patterns today that will help you connect down to those pelvic floor muscles and help you open the pelvic floor. Great. So let's go into it. We're going to do 3 things. We're going to go over how to breathe, to how to activate your diaphragm in your pelvic floor. We're going to go over how to poop, and then we're going to go through rebuilding and beefing up your glutes. I might throw in some extra stuff, but that is what I think is a really important focus. And we'll also talk a little bit about managing your intra-abdominal pressure so that you can keep your organs inside your body for your eternity. A lot of times after we push babies out, we're not just pushing babies out, especially if it's for a long period of time, we're pushing our organs down and out. And so we want to help them go back to their places after babies. And the answer to all of this is not Kegels, just so you know. If you've been told to do Kegels or you're doing a program that's driving with Kegels or telling you to do Kegels, really second guess that. Because, like I said, most pelvic floors are stuck in a more tightened position or just shortened with more scar tissue. And so doing more Kegels isn't actually that helpful because we want this range of motion to be able to be a force absorber. I'm looking at the questions here. We're still good, I think. Okay. If you have questions, please answer, or please put them in there and I will answer them. So getting this diaphragm moving. So the diaphragm sits under the rib cage. And so our ribs, they expand when we're pregnant. And that's just normal pregnancy. Our ribs expand because our joints get looser and we have to make room for the baby. So your bra size might have changed during pregnancy. It doesn't necessarily just go back to normal. So we have to help our ribs go back to normal and help that diaphragm regain its strength. So one of the things we're going to do is called a diaphragmatic breath. And so you're going to have, let's see, I'm going to get a little further away here. You're going to have, maybe not with my headphones though. Can you still hear me? Yes. Okay. You'll have a hand on your belly and a hand on your chest. And if you imagine taking a nice deep breath into your belly and exhaling, that is your diaphragm going down towards your belly. You can also work your diaphragm by putting your hands out here and then breathing into your hands out here. Exhaling imagining that if your diaphragm was like an upside down umbrella, you were trying to increase the width of that umbrella and then decrease it on the exhale. So you can do both directions. This is more called lateral costal breathing. You might find that type of breath in some Pilates-based programs. And that type of breathing is just fine. But when we're talking about using the diaphragm to help unhook the pelvic floor and gain range of motion in the pelvic floor, we want to drive the breath into our bellies. So we'll have you go deep breath into belly, exhale, and let it go. So let me just clarify. You can work both directions of the diaphragm. You can do this way, the lateral costal breath, and the belly breathing. But in order to connect to the belly, to the pelvic floor, and to really open the pelvic floor, we're going to focus on this type of breathing, the belly breath. So both are great. Both can be done safely and really well. So we're going to take a nice deep breath into our bellies, trying to keep our chest relaxed. Exhale and let it go. This type of breathing might seem easy and it might seem challenging. I've worked with some people that are like 3 years postpartum recently in the last 2 weeks, and they haven't had this control at all. It's like their bellies just froze and they were working so hard on sucking in for like 3 years postpartum. And so they didn't have that ability for the diaphragm to go into the belly. And again, we want to create that ability so we can make sure that we have that core that can be absorption to do shock absorption. So that's the first phase, the diaphragmatic breath. 5 minutes a day, easy peasy. It's relaxing. It should feel good. You could do it before you fall asleep, and you can fall asleep while doing it. It's a good way to shut down the day. Number 2, how we turn that into also a pelvic floor exercise is if you're sitting right now, it's a great way to start to feel it. You can feel like your sit bones. These are your sit bones. You can feel them sitting on the chair if you're on a harder surface. And if you inhale into your belly, I want you to try to feel your pelvic floor open. So what this could feel like is it could feel like if your vagina was a flower, we are trying to inhale and blossom the flower from a bud to a full blossom flower. Exhale, you might feel some recoil, so it becomes more of a bud again. Inhale and open. Exhale, you get the recoil. If you're like, what is she talking about? I cannot feel my vagina moving. That's a great sign that you should get a pelvic floor PT to work on it, to work on you, to really try to get connection to that movement. You can also just at home at night, if you feel comfortable touching yourself, you can just stick a finger right outside your vulva, so towards the vagina or inside the vagina, and feel if you can feel that opening. Can you feel it recoil? And we want to get you so that breath can control this type of movement. If that's hard for you to feel, you could try to connect down to your anus and think about inhaling and opening. Exhale and let it go. And so that's the dynamic range of motion that we want to get from our pelvic floor. This is challenging when there's scar tissue there. This is challenging. I'm 2 years postpartum. I've really progressed my fitness over the last year. And when I'm lifting heavier weights, like I like to do, my pelvic floor can get really tight, and I have to consciously unhook my pelvic floor from being in that tightened position. For me, when I get in that tightened position, I have a pelvic organ prolapse since before I had kids, and I become incontinent. So I can't hold my pee. So if my pelvic floor is tight, I will be peeing my pants. And I know that might sound different to some people, because some people are like, oh, you can't hold your bladder, you have a weak pelvic floor, you need to strengthen it. Most of the time, especially for women that are premenopausal, and Riley, do you agree with that? Premenopausal for sure.
Oh yeah, definitely.
If you're premenopausal, most of the time the incontinence is not due to needing to do Kegels or needing to do strengthening. It's due to you're too tight and we need to release it, so your body can naturally contract when you have to pee or when you do something with force. So I know it doesn't make all that much sense. And there's just so much on the market that like people are telling us we need to do, like buy these trainers for our pelvic floor, go sit on these chairs that give us all these Kegels. And that doesn't specify just the pelvic floor. And that can create a lot of other compensations and issues that build up because we're not getting our core to work for us. The core naturally works. We don't have to like work the core. We should be able to move our bodies with a healthy core. And that's why getting this range of motion is just so important in the pelvic floor. Does anyone have questions so far? So if you do that 5 minutes of breathing a day, it's a great way to start training and retraining opening your pelvic floor. You shouldn't feel like you have to push the pelvic floor down at all. You should just feel like, oh, I can breathe and control that breath. A lot of times what we do in clinic to help improve that ability of you to just naturally open is we do manual work inside the pelvis. So if this is your pelvic floor, the pelvic floor has 3 areas here. We have the vagina, the vaginal opening, where baby comes out and where anything penetrative happens. We have the anus, where for bowel movements, and then we have the urethra for peeing, and clitoris for stimulation and climax. And if these are tight and not working, all of these holes and areas are affected and don't work as well. So signs of any pelvic floor dysfunction could be urinary incontinence or feeling like you have to pee all the time. If you can't make it an hour, if you can't make it 2.5 hours without peeing, and it's regardless of the water you drink, a lot of times it's just because of the tension in the pelvic floor has fascia that connects to the bladder. And when the pelvic floor is tight, it can pull on the bladder, making it feel like you have to pee all the time. And so helping release those areas and release that tension is going to help release that sensation that you have to go all the time. So that's related to the pelvic floor. Anytime you're leaking urine, that's related to the pelvic floor. I know it's like really trendy to get Botox in your bladder or to take bladder pills because you don't want to deal with it. And most people I talk to don't really care that they pee their pants. Especially postpartum, everyone thinks it's just part of the process. But if the pelvic, if you're peeing your pants, that just means your pelvic floor is not working for you, which also means that your core isn't being that force absorber to protect your joints, your hips, your back. And so that's where it's like, let's get that working. And yes, you'll be continent and won't have to wear pads and all that good stuff, but you'll also be protecting and saving the rest of your joints. So it's super preventative. And then if there's bowel is more complicated, there's a lot of things that are involved in bowel movements. But if any constipation or hemorrhoids or anal fissures happen during your pregnancy or are happening now, definitely see a pelvic expert PT because so much of that can be controlled from what's happening here. Another thing that happens when we're pregnant is our organs. So our abdominal organs here, the colon. So this is my right side of my body. It's going to look backwards. I should do it backwards, but I can't figure it out. This is the ascending colon, the transverse colon, and the descending colon down into the sigmoid colon. And those organs get pushed out to the side, along with your liver and your stomach. And they have to come back together. And a lot of times they don't come back together until we've really regained our core strength. But even after that, sometimes they just they're not like in the right spot. So bowel movements can feel more challenging. And that's another thing that a pelvic expert PT can do for you is to really help those organs be back in the same spot. So your core can kick on for you better. Hopefully you guys can see me okay. The glare is a little intense. The sun is out. So, okay, cool. So we talked about the breathing. That'll help get the diaphragm moving. Another tip to that, if you're like, I'm having a really hard time feeling the breath into my belly, is to press your ribs together and then take a deep breath into your belly. And that can just shortening your own rib cage can help improve that expansion of your diaphragm down to your pelvic floor. So play with that a little bit if you have a hard time getting that breath. And then also play with connecting it down to the pelvic floor so you get that pelvic floor opening. Beautiful. I'm going to skip ahead and then we'll go back to bowel movements. But because we're talking about like maintaining and building this really great pressure of the soda pop can, I want to talk about the pelvic organs. So when we have a baby, the baby grows for 9 to 10 months on our bladders. When that happens, the baby is pushing down on our bladder and the bladder takes a lot of force to stay in the same place. And then when we go to push our babies out, we're not just pushing down the uterus and the cervix, baby down through that. We're also pushing our bladder down. We're pushing the back of our vagina down, which is our rectum. And so we have to help keep those and heal those back into the areas that they came from. So a lot of people have these issues where it's called a pelvic organ prolapse, where the bladder comes in or the back of the wall, the posterior vaginal canal wall comes in, and that's called a rectocele. These two areas, we don't want that. We want them to go back to their places. When these persist, a lot of times people end up with a pelvic mesh or bladder surgery to fix their bladder. And those are really only about 40% effective. And I truly believe that's because people don't know how to have good pelvic floor mechanics and like relax their pelvic floor and how to breathe after they get the surgery. They just think a surgery is like one and done and we're good to go. And so in order to, regardless of if you end up with the surgery or not, hopefully we can prevent that for you. Most of the time we can. You want to learn these mechanics. So we're going to go into what's called blow before you go. So this is decreasing your abdominal pressure to create core stability. Okay. So a lot of times people are taught to like breathe in, like when you go do a squat, or if you are an Olympic lifter or power lifter, you're taught to inhale and then do your squat or do your deadlift on the inhale and hold your breath. And that's what gives you stability. For people with female anatomy, that puts a lot of pressure down on our organs because we're inhaling and then like keeping that and doing a more forceful movement is going to push down our organs even more. So our goal is to keep our organs inside. So we want to use this method called blow before you go, or blow as you go. And what you do is anything you do with exertion, you exhale to blow off the air. So you're decreasing the pressure in your belly. So you're decreasing the amount of force down on your bladder and on your rectum. Okay. So that is one really crucial thing that you can start doing. So even if your baby is only 7 weeks or is 24 months, my baby, I guess, is 26 months. I guess that's how old Jayla is. I can't do math. Maybe she's 27 months. She's heavy. And like, so when I pick her up, I am blowing in her face, like shh, every time I pick her up, because I have to make sure that my core comes in and I use the shh sound because that helps activate what's called your transverse abdominis, which is your lower ab muscles. And so we use that shh to help decrease the pressure, but also to activate the core muscles. So if you learn nothing else from this webinar, do some diaphragmatic breathing, do the blow before you go or blow as you go. And that will help protect your pelvic organs. So that was a little bonus tip I didn't even plan on teaching today, but I think that's really important when we're thinking about keeping our organs in the right places and helping them go back to their places. If we do a squat, you're going to have to play with your squat. Everybody's going to feel a little different than this. I typically inhale on the way down. So exhale on the way up. You might feel, especially did you tell me how many months postpartum you are? Oh yes, you were 7 weeks. Okay. So you might feel not comfortable doing that yet. And you might have to exhale the whole time. You might have to the whole time you squat. That is something that you can play with and see what feels best on your body. So I inhale on the way down and exhale on the way up. For me and my prolapse, that's what's best. But for you being 7 weeks, you might have to exhale that whole time in order to feel supported. But play with it. And I would definitely get checked by a pelvic expert PT. You want to know where your organs are at. You want to know a lot of things. You want to know how where your organs are at vaginally. You want to know where your colon is at and how it's moving in the belly. You want to know if you've had a diastasis at all. And then you can start just healing that and working through that. And again, dealing with any of that scar tissue too, that's there. Okay, so that was the first 2 things. We're going to go through 2 more things. We're going to go through pooping and then glute activation. So like I said, the theme of this is okay, we just pushed our babies out and now we have to keep our organs in for the rest of our lives. If we do that, then we're going to be more continent. So we won't be peeing our pants as much. We won't be pooping our pants. We won't be having farts, the ladies that roll over in bed and they're just farting. If you've hung out with your grandparents and that's what they do, that's a lot of times they just lose control here. We lose control in our pelvic floor. The incontinence industry, multi-billion-dollar industry, selling pads, selling Botox for the bladder, selling pills for the bladder. It does not need to be this way, because if we actually healed these areas in our core, we would also be preventing joint replacements and things that medical procedures that make people very wealthy. So it's important that we do this, even though this isn't, as easy as taking a pill per se. So bowel movements, it's really important that we get our stool to a good consistency. It's something that we can do, work with you in clinic for, but you want to get your stool to a consistency where it's soft but well formed, and it feels like you can just breathe the poop out. So you don't have to like sit and push it out, especially if your kids are pushing poop out. If you have any toddlers running around or older kids, this is how you're going to want to teach them to poop, and teach your partners to poop like this too. So, if you have a squatty potty, that's fantastic. You stick your feet up on a stool, and that helps bring what's called the anal rectal angle into a straight chute. So it straightens the chute for the poop. You can lean forward and like rest on your knees if you don't have that. And what you do is just the breathing we did earlier. You do 3 deep diaphragmatic breaths into the belly. So 1, exhale, 2, and on the 3rd one, if the poop hasn't come through, you gently bear down like you're trying to fart, but you don't want anyone to see you fart. And so that would be the mechanics of having a good, healthy bowel movement, is to sit on the toilet, either bend forward or stick your feet up on a stool and do this breathing to stimulate the poop. Ideally, you get an urge to poop before you just go and start breathing on the toilet. You want to, when you get an urge to poop, you want to go about 15 minutes within getting that urge. You never want to delay the urge to poop. Delaying the urge to pee is fine. Delaying the urge to poop is not fine, because you can lose that reflex. So always listen to that. And if your poop is a consistency where it's like hurting to get out, or you just can't breathe it out, then you're going to want to work on that. Increasing fiber, talking to your doctor about more natural supplements like magnesium or raha psyllium. Those can be ways to help improve the consistency of the stool. As a new mom, or any type of mom, it is so hard to have the dedication to sit on the toilet and breathe your poop out. So to like, if that's something that you can just start to shift, even if you forget to do it a few times, make yourself sit and breathe. And that is going to help it. So you're not pushing your poop out. When we push our poop out, not only is that going to set us up for pelvic organ prolapse, it's going to set us up for hemorrhoids, anal fissures, and just a lot more issues with our continence, like our bladder and stuff. So hopefully that all sounds good. That is breathing your poop out. Last but not least, when you think about starting to get your fitness back and really get your strength back postpartum, one of the most important things is to get our butts back. So many moms have flat butts, and I don't say that because it's like a mom thing, but that is just the truth. When women are pregnant, we lose what's called hip extension. So this is the ability of our body, of our leg, to come behind our body. I'm still working really hard to get it back on my left leg. The ability of the leg to come behind my body. You'll see that like I can only get to neutral, and then my back I start to like arch into it, and my back starts to do a lot of it. So one great thing to do, this wasn't what I was going to teach you, but just to start stretching the front of your hip, stretch your hip flexor. This could be a stretch that you do to start opening up the hips and get the extension back. We see so many moms that go back to running, and I'm so guilty of this. For my first 2 babies anyways, I haven't made it back to running for my 3rd for many reasons. One being I don't have this hip extension, and I'm trying to listen to my body this time. But what happens is they go back to running at like 3 months, and their pelvis is still separated. And so their base of support is different, and how the forces are coming up their bodies, and they don't have this hip extension to have any glutes. So it becomes very hard on your back and your SI joints, which are these little guys back here, and really on the rest of your body. So you want to get that hip extension back before you really start doing a ton of running. That is like the most important thing to get that hip extension. And then for walking, say you love pushing the stroller, start working on getting that hip extension, because once you get the hip extension, then you're utilizing your glutes. So glute workouts are amazing. Doing some bridges, you'll get like a whole there's like a little program here in the back of my book. I have the breathing, I have bridges. I think there's like different core exercises. So you can use that program. It's, it's very basic. You should work with a healthcare professional to like make sure it feels good in your body. And if it doesn't, don't do it. But you want to build those glutes so you can help really start to utilize your glutes as a force absorber as part of your entire core. So getting that hip extension is absolutely important. Any questions about that? Cool. Well, we have two very special people on. I think is it two? My team can tell me if there's anyone else. And I'm making them a panelist. Yay! Leanne, you're going to be a panelist. Jamie, you're going to be a panelist. Cool. Maybe this works. You feel comfortable turning on your yay? Hi.
I always just forget where the buttons are. So
okay, let's start with you. Hi, Jamie. Okay. Do you mind sharing when you started coming to Body Motion postpartum?
Yeah. I thought this was kind of fun because when I first met you, it was a virtual discovery visit. I was like, oh, this is kind of cute. It's like a little full circle moment.
Yeah.
So yeah, it was April of 2020. I gave birth to my first baby 12 weeks before COVID hit. So I'm in the stress of being a new mom, and I delivered via C-section, unplanned C-section. I labored to like 7 centimeters. So I feel like I was sort of recovering from a partial vaginal birth and then also an unplanned C-section. I labored with her for, I think, 56 hours. Yeah, sorry, you asked me when I started coming, and I'm going to tell you my whole birth story. I was like, when somebody asks me a question like this, I'm like, hold on, I'm going to tell you the whole story. But yeah, it was April 2020. I remember my lower back. I basically threw out my lower back in a way that I don't remember in my adult life. And I remember laying on the floor. I was unable to get up off the floor for like 15 or 20 minutes. Thankfully, my baby was asleep. So I just kind of laid on the floor. And I remember like Googling on my phone, postpartum and PT. Like I knew that postpartum had something to do with it. And I knew I needed a PT. So I just typed that into my phone. And thankfully I live in Edmond. So of course, Body Motion was like top of the results. And then I scheduled a discovery visit with you, and the rest is history.
I love it. I love it. So we started doing some recovery for your back. I mean, not just your back, but also, the back was the symptom. And I think that's really important to know, like, if you have back pain and you've had a baby, even if it's 20 years down the line, like, it's probably related to some part of your core that wasn't addressed. I feel like it's almost like, I don't know if this is wrong to say, but it's like lucky, like that happened 3 months in.
Yeah, no, totally.
Because then we got to heal the whole entire C-section and rebuild your core from the ground up. And when you do it that early on, it's like, there's not as many compensations to break up,
Right.
And so, yeah, it was a great, I love working with you. And yes, we still get the honor of seeing Leanne on the maintenance program, because truly, if our bodies continue to progress and as our hormones fluctuate and change, do you want to share how you went on to have another birth?
Sure, yeah. And if I just keep rambling, tell me to stop too, because I will. I remember like when I was pregnant with my first, I had this thought of like, if I had to have a C-section, I would just have a repeat C-section. Like that seems straightforward. But I remember the first question I asked my OB, like I think I was out of the operating room like 15 minutes. I was like, can I have a VBAC? And I was like, wait, I want that? Because motherhood is so filled with opinions on everything, and sometimes it's hard to like separate what your voice is and like what other people's voices are. So it's like, wait, I do want a VBAC, and I'm already thinking about having a second kid, and I'm holding my like 10-minute-old baby. So of course the recommendation is to wait to 18 months to get pregnant with your second. I think I got pregnant like a week before the 18-month mark. Yeah. And then I saw Dr. Riley for a lot of my prenatal care for my second, which was so good. What else do you want to know? Just like
No,
how the
that's
labor
great.
and
Yeah.
delivery
Do
was.
you feel like sharing like where your body is now and how you've progressed into like the weight
Yeah.
training kind
I
of?
mean, I definitely still feel very postpartum because I'm nursing my 18-month-old and she still wakes up at night to nurse. So I feel like I'm producing a lot. So I feel like my joints still need like support from you guys, you know. I'm also a musician by trade, and I kind of exist in this like asymmetrical place all the time because I play cello. So I feel like just kind of what I do as a mother and a musician, I sort of need the like ongoing maintenance. I mean, my body, I wouldn't say it's perfect because I mean, I don't sleep very well at night. I don't heal, but it's a much like night and day difference between my first postpartum experience and my second postpartum experience. I had a VBAC. I guess that was I did have a VBAC. Yeah, and it was my first sort of got like lodged in my right hip, and I kind of felt her there during my pregnancy. Like in retrospect, I'm like, oh yeah, you kind of just like lived there. She was also torticollis when she was born. And then my second, I kind of felt that happening during labor, like she was headed that way, and but she made it into the pelvic bowl. And the second that happened, she just like flew out. So it's like apparently my babies just take their time getting into my pelvic bowl, and then when they're there, they just fly out. So I had a very minor tear, but I also have 99th percentile head babies, like greater than that was one thing my OB said, like when she pulled her out, she's like, oh, this baby probably wouldn't have come out of you anyway. And that like really, she was well-meaning, and I really loved her, but like just that statement, I felt like also kind of fueled my desire to be like, no, you're wrong.
You proved her wrong.
Yeah.
Yeah, no, and we didn't talk about that during this webinar, but like doing pelvic floor PT and really prepping your pelvic floor for birth helps the recovery process so much.
Yeah.
So even if you do have a tear, your muscles are already hydrated and used to going into those expansive ways. So there's a lot of blood flow that's already perfusing the muscles that you don't typically have when you aren't working on them per se. So yeah, it healed much faster than
and of course you did tons of scar mobilization on my sorry, there's baby sounds in the background, on my C-section scar, and that was like one of my big like anxiety points during my second pregnancy was uterine rupture. I like thought about it a lot, but I felt very minimal like sensitivity around my C-section during my second pregnancy, around the incision site. And I have a lot of mom friends who are like, my C-section scar like ached, like it burned when I was pregnant. And I noticed it a couple of times, but it was never like a burning or an aching or stabbing pain like some of my mom friends talked about.
I'm going to interrupt you for a second.
Yeah.
For anyone who's had a C-section, one of the things is that the scar tissue goes through the uterus itself. So the scar tissue isn't just on the skin, it's very deep. It goes 7 layers deep all the way into the muscle of the uterus. And so it's important that we work those. And there is a relationship between cesarean and uterine rupture. And so it's not shown that scar tissue mobilization helps that, but it's hard not to think like, hey, if this is moving well within the body, then it's going to have a better. I'm
certain it helped, because I was Googling too. I'm like, is this research backed? And I couldn't find much on it, but I'm like, there's no way it didn't. Like,
clinically.
It just like grew and moved better. So it just seems really straightforward to me. So
thank you so much for sharing. Thank you for being here, and I appreciate it.
Yeah, of course.
Great to see you. All right,
Hey, Allison, really quick, can I Can I mention
Yeah.
one thing?
Yeah.
Sorry. If you're able to make Kamala a panelist as well, perfect. Yeah. Great.
Yay. Okay, cool.
Cool.
Hi, Jamie. Did it work?
Hi.
Oh, great. Perfect. Hi. Thank you for joining us. Can you hear me?
Yeah, I can hear you.
Okay, cool. Do you mind sharing a little bit about when you started therapy?
Yeah, I was actually trying to figure this out because I feel like body motion physical therapy is like, I feel like you guys are now my friends and I see you all the time. And I was like, when did this start? And I actually think, oh, sorry. I started when I was pregnant with my second. So I didn't get any kind of pelvic floor therapy with my first, or really postpartum with my first. And then I had such bad back pain when I got pregnant with my second with Hank, such bad back pain, and had such horrific incontinence issues that I think that's what ultimately drove me to see you guys. So I was actually like 3 months pregnant with my second child when I discovered pelvic floor physical therapy.
Amazing. Well, and then the back pain was gone during that, after that second.
Oh my gosh.
during that
Yes.
second?
It was like, I thought, because I think being pregnant with my first Beau, I just didn't know much about birth or pregnancy. And I just kind of figured like, oh, I'm one of those people that's like not going to be able to walk pregnant. And I'm one of those people that pees myself after I give birth, like just these norms that you hear. And I think coming to pelvic floor physical therapy helped me realize like, oh, we like actually don't need to pee ourselves when we start giggling after a margarita, and I can walk when I'm pregnant. Like, this is amazing. So yeah, it was, I feel like it felt like a miracle how quickly pelvic floor physical therapy helped with my back pain in pregnancy.
Yeah, fantastic. I love to hear that. Recovery postpartum. Do you remember number 2?
Yeah, I would say like my births went bad, better, best. Because with Hank, I also delivered like a week into the shutdown. And so I didn't get in for as much postpartum care as I probably should have or would have liked to, just because of my COVID concerns. But when I finally got in there, gosh, I don't know how old Hank must have been, maybe 4 months. But I never had, I had zero incontinence issues after Hank. I just kind of have a bad back, but I feel like even that I was able to return to activities like playing tennis and exercising that I didn't think I would be able to after having kids. And then when I had my third, Maisie, it was like the fastest birth, no tearing. I got right into physical therapy after. I feel so like now I tell everyone, I'm like, you got to go when you're pregnant and you got to go postpartum. You don't have to pee yourself on a trampoline. Like, come on, ladies.
Love it.
Oh yeah. Sorry.
No, that's fantastic. Thank you so much for sharing. And I think it's amazing. You're still breastfeeding. Maisie is 8 months, right?
She's 10.
She's 10. Okay.
She's 10 months.
And you are playing tennis and just like doing it all. So I think it's amazing. And yeah,
your team is amazing. So I can do it. So thank you.
Yes. Well, thank you so much for joining and sharing. Move to Kamala. Hi, Kamala. Thank you so much for joining us.
Hello.
Hi.
Can you hear me?
Yes, I can.
Okay, good.
I think I lost Jamie, but that's good. That's totally fine. Cool. Well, tell us a little bit about, if you don't mind, when you started with body motion.
Yeah, so I've actually been through 2 rounds with body motion in the same postpartum sort of recovery. I went the first time when Luca was about 9 months old.
Okay.
And then went back again when he was about 2.5 because I started having new things pop up.
Yeah. Do you mind sharing a little bit about your initial recovery?
Yeah, so I felt pretty good after birth. I had, another COVID baby, like like everyone who's born in June of 2020. And so I wasn't back to normal activities besides walking around the neighborhood for like quite some time. I danced with Bailadores de Bronce. It's a traditional Mexican group based out of Seattle. And I didn't start going back to rehearsals until he was about 9 months after I got vaccinated. And once I was there, I started noticing like heaviness in my pelvis when I was dancing. We dance in heels, and it just, nothing hurt, nothing felt bad, but things felt very different. And so I initially came in really as a gut check to make sure that everything was sort of okay, because it was a new sensation. And got in, and yeah, we found that there was a lot of tension and stuff going on that, I wasn't seeing so much walking around, but when I'm dancing and jumping and moving in heels, it felt very different.
Yeah. Yeah. So that initially went away. I think this is a good example. Like the body changes so much, not just at 9 months, but like continually, right? As we go through motherhood, and like our fitness changes, our jobs change, as like, the size that the kids are. So when 2.5 comes along, all of a sudden you're carrying a much heavier baby. So tell us a little bit about that second round.
So second round, I had weaned between the first round and the second round. I nursed my son for about 25, 26 months. I nursed him, pretty long term. And sort of, around when that happened, I started going back to dance with more intensity. I got a new job, and, things were going okay. And then I noticed at Christmas when we were on vacation that I was starting to feel almost like I had like an internal, like I could feel something in my pelvis that didn't feel right. Sort of the feeling when you're using like an internal, menstrual product, when it's not sitting right, that you can sort of feel it, like when you're sitting down. I started noticing that. And then I started having some bladder incontinence, which I had not had the whole time. And I was sort of like in denial about it for a while. It was in my head. I drank too much water too fast, and was sort of like with excuses. And then finally, at one point, I noticed when my husband and I were having sex that things did not feel right. It was really pinchy, and it didn't hurt, but it was so like distracting that it was starting to affect even that part of my life. And that's when I decided to come back in.
Oh, I'm so glad you did. And so things are better now.
Things are much better now. Yeah.
Good. I love to hear it. I think that's important to say. Like we do this work and we get the pelvic floor tuned up. We really work, getting your pelvic floor, getting the scar tissue out, getting it able to relax. But then as we progress through like different fitness, things change. You stop breastfeeding. It's such a dynamic change. That's why we do a lot of maintenance. So people stay on a maintenance. They come once a month or, a couple times a month just to maintain their good pelvic floor tone. I put this on the internet yesterday. I can't believe I actually say this online, but like I started peeing my pants tremendously last weekend after I played hockey. And I just was like, I can't believe I don't have this control. This is what I do for a living. But it had been like 3 weeks since I had pelvic floor therapy. And with all the lifting and new activity I was doing, like everything just tightened up and I had no control. Since my PT session, my one session, all of a sudden my control is back. I can cough and not pee. Like it's just incredible. I wish it could be a one and done situation. But it's like one of those things that it's like, as long as you know how to maintain it, you'll be able to maintain it, and maintain that tone. But our bodies are, continually changing, and it just speaks to the fact that we have to keep being dynamic and supporting them and, keeping them healthy. So thank you so much for sharing. I think we're wrapping up here, but if, anyone has any questions, I'm here to answer it. Thank you so much for joining. Thank you for sharing, Kamala, Jamie, and Leanne. This was absolutely amazing. And I want to see you dance the Mexican dance. So if you do any shows,
we have a show on October 25th, the Moore in Seattle.
Is that a Saturday?
It's a Wednesday, which is rough. It's the group's 50th anniversary.
Okay. I'm going to see. I'm going to reach out to you. That sounds amazing.
Yeah.
Very cool. Well, thank you. And I am excited to hopefully help those of you on here. If you have any questions, please reach out. We're happy to dive into it. So thanks for being here. Take care.